Okay, chapter 15 is the nervous system. And like the previous chapter of the endocrine system, this is also a messenger system. The function of the nervous system is to send electrical versus the endocrine system is chemical. The nervous system sends electrical messages also to maintain homeostasis, allows us to breathe, allows us to walk and talk. Very, very complicated, amazing system. Basically, and you do not need to know this anatomy, but basically there are neurons that are the nerve cells and neuroglia. Now you will come across glia. Glia means glue. And we'll talk about that when we get to the word roots. But just know that neuroglia makes up the nervous tissue, but it's like nervous tissue glue. We have the central nervous system, which is the brain and spinal cord, and the peripheral nervous system, which is everything else, and the brain. And the brain, just to give you some context, the main part of the brain, the part that we always think of when we think of brain, this is called the cerebrum, the big main part of the brain. It has lobes that have different functions. For example, the occipital lobe in the back has to do with our vision. It also contains what they might call us the tiny brain or little brain, and it's the cerebellum down here. And that has to do with balance and posture. And then deep inside the brain, you can only see it in this cross section here, is the midbrain that contains the pons, the spinal cord, and the medulla oblongata. There are 12 pairs of cranial nerves. And we have the spinal cord. The meninges are a fluid-filled sac that surround the brain and spinal cord, and they kind of cushion it so you don't have brain tissue on top of bone, the skull, the cranium. So there's a meninges, which is like a shock absorber. But on the spinal cord versus the brain has 12 cranial nerves. The spinal cord has 31 cranial nerves. Okay, jumping into the word roots that you need to know for this class. And I want you to be careful. A couple of things here. So let me switch out. Let me switch out real quick. Make this clear to you. I like to highlight to you what sometimes trips people up. So cephalo, ooh, I don't want to write in yellow. Let's write in blue. Cephalo is the head, the entire head. So your ears, your nose, everything, okay, the head. Cranio is your skull, okay, or the cranium. Okay, so that's the bone, okay. Encephalo has to do with the brain. Think inside head, right? What's inside the head? The cephalo is the head. So if it's inside the head, it's the brain, okay? What I was about to show you are the different parts. We have cerebro is the cerebellum, or I'm sorry, the cerebrum. And I'm getting ahead of myself. Cerebello has to do with the cerebellum, right? The little tiny brain. So these sort of sound similar, and I want you to just kind of understand the difference. One is the head, encephalo is the brain, one is the skull or the bones, right? And then these last two are talking about specific parts of the brain. Okay, so I wanted to show you that distinction. Okay, let me go back to sharing my PowerPoint. Okay, I'm gonna have to jump ahead a little bit here because we've been through this. Okay, now you've got, oh, oops, too fast. Now you've got a somewhat of a basis for what we're talking about. Okay, we started here with cerebro. Talking about the colored portion of this diagram is the cerebrum. It's the whole brain. Okay, it's the main part of the brain. Cerebro, the cerebrum. Cranio, again, skull. So if you have craniomalacia, malacia is meaning softening, it's softening of the skull. Encephalo, like I said before, think inside the head. So what's inside the head is the brain. Okay? No part of the brain specifically, just the brain in general. Okay? Ganglio. Ganglio stands for ganglion. And if you don't know what ganglion means, it's a knot or a knot like a ball of nerves. So a knot like mass of nerves or ganglion, the word root is ganglio. Here's that glio, and glio stands for glue or neuroglial tissue. Kinesio. Kinesio is movement. A kinesiologist is a person that studies movement. Bradykinesia has to do with slow movement. So it's included in this chapter because sometimes people who have Parkinson's disease, which is a nervous system disorder, may have slower movements. Bradykinesia. Okay, meningio or meningio, that was the, refers to meninges. That was the sac, the covering, the protective mechanism around the brain and spinal cord. So a meningoceal is herniation or swelling. Meningitis is inflammation of the meninges. Meningioma is a tumor in the meninges. Myelo. I want you to star this one. This one sounds dangerously close to myo, which was in the muscle chapter. Myelo has to do with the bone marrow and the spinal cord. So bone marrow for the musculoskeletal system, but spinal cord here. Okay. So spinal cord, myelo. And not to be confused with myo, which is muscles. Narco is stupor, numbness, sleep. So a narcotic makes you sleepy. It literally means pertaining to sleep, numbness, stupor. Okay. Neuro means nerve. So neurolysis, lysis meaning crushing or destroying, separating, means that happened to a nerve. Psycho does not mean crazy. Psycho used to be an old movie, means mind. So a psychologist is someone who studies the mind. Psychology is the study of the mind. Okay, radiculo is an odd one because it doesn't sound or have any connection to what it means. It means nerve root. So coming off the spinal cord, we have these nerve roots. And that is what radiculo is referring to. So if you have, if someone says I have a pinched nerve in my neck, or I have pain in my neck, pinched nerve, what they're really meaning is they have radiculalgia. Try saying that 3 times fast. So if you have a compressed nerve root, that might cause radiculalgia. Thalamo is referring to the thalamus, which is inside your brain, part of that midbrain, the thalamus. Tono has to do with tension. So it requires some tension or strength to hold your head up. In this case down here, we have cervical dystonia, dys meaning bad or difficult. So if someone has a pertaining to a condition of bad tone, that means that their head may be weak to one side or flapping, or kind of fall forward. They may not have adequate tension in their neck to hold their head up. Ventriculo. Inside the brain are these 4 ventricles. And ventriculo means those is referring to those ventricles, not of the heart, in this case, the brain. Okay, your suffixes, algia and algesia. I know you've had algia and dynia before. Now we're adding a third one for pain, algesia. So neuralgia is pain in the nerves. Analgesia means condition of no pain. So an analgesic is what we would refer to like Tylenol or ibuprofen. That would be an analgesic. A painkiller, what layman might say a painkiller is really an analgesic. Okay. Synalgia, syn means same or joined, or union, has to do with pain in a body part that's joined to an organ in a different place. And I have a great picture of that that's coming up. Okay, now be careful here with algia and algesia. You might want to star asthenia, and aesthesia. We're going to get to that in a second. Asthenia has to do with weakness or debility. So myasthenia is weakness or debility in the muscles. And here's your S. I'm trying to really overpronounce the difference. Aesthesia is feeling. When I get confused with these, I always think of, I want to have surgery with anesthesia. I want to not be able to feel it. So anesthesia literally means a condition of no feeling. And that's how I can remember, okay, asthenia is the other one. So aesthesia is feeling. Here is kinesio. Is movement, just like kinesio was a word root for movement. This is this in suffix form. Lepsy. Lepsy means seizure. You may think of epilepsy is a seizure disorder. So lepsy means seizure. If someone has narcolepsy, and I asked you to Google that, it may say something like a condition where you fall asleep at the wheel or in an inappropriate places. But in our world, narcolepsy means seizure of sleep. Okay, or numbness, seizure of numbness, seizure of sleep, one of those, or stupor. Okay, other ones that you should star, paresis and paralysis. So paresis, think part. So partial paralysis. It's only part paralysis. Paresis is partial paralysis, not total. Phasia with a S, think S means speech, is not to be confused with phagia, which is with a G, eating or swallowing. Okay, so phasia is speech. So if you have dysphasia, you have difficulty with speech. If they have aphasia, they have no speech. Okay, plegia, so plegia and paresis. Plegia is total paralysis. Okay, the entirely paralyzed, not part. Okay, so the two that you may want to star there are plegia and paresis. Taxia. Taxia has to do with how we move in an order or coordination. So for example, riding your bike requires a lot of the brain to kind of automatically left, right. Walking upstairs requires a lot of order and coordination. If someone has a condition of ataxia, it means they're missing that ability to coordinate their left and right side. Okay, prefixes. Para means near, beside, or beyond. Okay, para means near, beside, or beyond. Here's that great diagram I was mentioning with the word syn for synalgia. Synalgia, for example, and I don't know if you realize this, but if you have pain in your liver, something's wrong with your liver, you may have right shoulder pain. That means the pain, the algia, is tied to the liver. It's just showing up in a different place. So that's what synalgia refers to. And if you look at this, this diagram, you could see some other ones that are kind of really interesting. Okay, abbreviations. CSF is referring to cerebral spinal fluid. So it's the fluid that's cushioning and circulating. Okay, cerebral spinal fluid. CT, we call that a CAT scan. There's no A in there for CAT, but CT scan is computed tomography. Okay. A CVA is a cerebral vascular accident. So cerebro, main part of your brain, vascular, the vessels, an accident happened, whether it be a clot or a bleed or an injury of some kind that causes stroke. Your CNS is your central nervous system, which I mentioned before was the brain and spinal cord. DNR stands for do not resuscitate. DOA is dead on arrival. EEG, so be careful not to confuse this with an ECG or an EKG or an EMG, which is an electromyogram of the muscles. So electro, right? Graphy is a written record, but in the center here we have encephalo. And encephalo literally means inside the brain or inside the head or brain. So what an EEG is a written record of the electrical activity of the brain. ENT is a specialty of medicine that specializes with the ears, nose, and throat. HA or H/A is headache. LOC is level of consciousness. So we'll document alert and oriented for level of, or comatose for level of consciousness. X-ray, just XR, stands for X-ray. Okay, TIA, could be a little confusing. If we think about a precursor to a CVA, which is a stroke, cerebrovascular accident, this is the warning before a stroke. So this sometimes happens, sometimes we call them mini strokes, and there's no damage. But it's kind of the warning 48 to 24 hours before a stroke. Or might be, just a limited TIA, but that stands for transient ischemic attack. Okay? And a transient ischemic attack can happen, like I said, in a day or two before a major CVA. Okay, some vocabulary. Syncope, remember that's not syncope. Syncope from our pronunciation chapter. Syncope has to do with dizziness and fainting. Okay, so if somebody has a headache and then all of a sudden passes out or faints because of decreased blood flow to the brain, they lose consciousness and they lose their posture, they fall down, that is syncope. Lethargy is extreme tiredness and fatigue to where you're not responding to normal stimuli. So lack of activity, if someone is just, or like a 4-year-old is laying on the couch and is not running around, that might be lethargy. It's abnormal level of activity, an abnormal, lack of response. They're lethargic. Okay. And the last part of this is diagrams, and you can quiz yourself here. You try these out. You have these PowerPoints so that you can practice. And that's chapter 15.